think there are two major problems. People get stuck in hospital, and I think hospital is a disability in its own right. And I think that once they get stuck, we really struggle because of issues about boundaries and social care. How can we respond rapidly, assess competently and thoroughly, and then take people back to the community? And I think doing it in their own home or step up may be missing the point, to my mind.
I think there's a lot of misconception from the public point of view into what actually urgent care means. A lot of them think it means, actually, I need to go on A&E, and they sort of bypass the GP surgery, they bypass all of the different avenues that you can do, and it creates a huge problem at A&E where they're queuing up and they can't cope with it.
What we need to think about really is the entire chain of unscheduled care, from the beginning of when a patient either rings 999 or 111 or simply turns up somewhere, then what happens to them on the way through that? How do we get control of it? How do we make sense of it? And how do we give the patient what they really need and then get them the appropriate services?
We have had pressures, but what I would say is that there's a real whole systems desire to improve that situation, and lots of people working really hard to prevent that from being a problem. But we do still have people presenting at A&E departments and calling us for things that really they should be self-help. If you have a cold, then you can get a remedy from a chemist, and pharmacies are a resource that people don't always access.
I think I'm encouraged by the discussion that I've heard. I think there's a recognition that we have to think big, we have to think bold, that we have to look at it from a holistic point of view, and a lot of people talked about looking at it from the patient point of view. And I think that's really reassuring, because I think that will stop us from just sort of doing putting plasters on problems and bolt-ons rather than redesigning them. So I think the talk about redesigning is very encouraging.